Hello, scholars. My name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click the subscribe button as well as the like button so I can continue to bring you videos that you want. Now, in the last video, we covered trichotillomania, and in this video, we're going to look at excoriation disorder. So let's begin. In order to be diagnosed with excoriation disorder, an individual has to have the following symptoms. A. The individual has to pick their skin so much that lesions eventually appear. B. The individual attempts to stop picking their skin multiple times, but cannot stop the behavior. C. The act of picking the skin causes distress to the individual and negatively impacts their social relationships, their job, or aspects of their home life. D. The person does not pick their skin because they have a medical condition that causes them to do so. E. The individual does not pick their skin because they have another mental health issue that causes them to do so. When a person has excoriation disorder, they are most likely to pick their skin located on their arms, hands, and face, as well as other bodily areas. People can pick acne, small lesions, large lesions, scabs, or even healthy skin. Not only do people use their fingernails to pick, but they have also been known to use tweezers and pins. A person may also bite their skin, rub it, or squeeze it. Those that have excoriation disorder will often pick at their skin for hours in a day. This behavior may go on for months to years of one's life. When individuals pick at their skin, they often will try to cover it by using makeup or attempt to conceal it with clothing. Sometimes when people are picking, they feel a loss of control, may be embarrassed by their behavior, or may feel shame because of it. Persons with excoriation disorder will often avoid social situations because they're worried others will recognize their skin picking. There are a percentage of individuals with excoriation disorder that will play with the skin that they pull off, and some will even eat it. The person who is doing the picking generally will be in a certain emotional state when they're doing so. The picking can come from being bored, having significant anxiety, with tension, and when the skin is picked, the person may experience a sort of gratification when lifting the skin from the body. Some individuals with excoriation disorder state they have an uncomfortable body sensation that feels better after they pick their skin. The person does not normally feel pain when they pick the skin. The amount that a person picks can vary depending upon that individual. Sometimes the picking will be automatic, and other times a person will pick and be more focused about it. A few people will experience both. Skin picking does not tend to happen around other people unless the person feels especially close to them. Those with excoriation disorder will sometimes pick the skin of other people. In the United States, 1.4% of individuals are diagnosed with excoriation disorder each year. 75% of those are diagnosed are female. It is normal for most people with the disorder to start picking their skin when they are in adolescence. The picking usually begins with a dermatological condition like acne. If the individual seeks treatment, their habits will come and go with time. This disorder can come and go for weeks, months, or even years. Excoriation disorder is found more often with people that have obsessive-compulsive disorder. It is also common in those that have a first-degree relative with it. Those with the disorder will often state they have the disorder, they know they have it, so they don't need to be diagnosed with it. It is tough for individuals with excoriation disorder to not pick their skin. Persons may spend up to an hour a day thinking about picking their skin, actually picking it, or trying to stop picking their skin. There are many individuals with the disorder that don't like to go out because they don't want people to know that they pick their skin. Those that work describe how tough it is to not pick when they are working. When a person is a student, they recognize how difficult it is to study without picking or feeling the need to pick one's skin. Excoriation disorder can be dangerous because the picking of the skin can leave openings to bacteria and eventual infection. It can also damage skin tissue as well as scar the skin. The use of antibiotics is important to make sure that no bacteria gets inside the body and causes infection. When a person has excoriation disorder, they tend to have other mental illnesses. These mental illnesses can be trichotillomania, OCD, as well as major depressive disorder. If you didn't get a chance to see what trichotillomania is, please see the video that is directly right before this. Trichotillomania is much like excoriation disorder, and usually if a person has one disorder, they tend to have the other disorder as well. Trichotillomania includes hair pulling, and the reason for the hair pulling is much the same as someone that has excoriation disorder. Okay, well, we've reached the end of our video on excoriation disorder. This is the last video of our series about obsessive-compulsive disorders, which are in pink on my YouTube channel. In the next video series, we'll be exploring trauma and stressor-related disorders, which will be in green. These disorders are reactive attachment disorder, post-traumatic stress disorder, better known to most people as PTSD, acute stress disorder, and adjustment disorder. After this, we'll begin looking at dissociative disorders, which include dissociative identity disorder, dissociative amnesia, and depersonalization derealization disorder. Now, these are some of the more difficult disorders to understand, especially if you've never experienced a dissociative state, but we will definitely go over them as best we can so that you feel confident in knowing those. I can't tell you enough how much I appreciate every single one of you on this channel. It has been an honor, and I just really am overwhelmed with the amount of comments and just excitement for what is coming. So I totally appreciate it. Thank you so much. I hope that if you have anything that you want through the channel, let me know, and I will totally get to that. And then thank you. I want you to have a wonderful, wonderful day, and I will talk to you soon.